Hello everyone and welcome back to Pathology for the Massage Therapist. Today we're going to be discussing Chapter 6, and this is all of the neurologic pathologies and disorders. Now, for a full list, I highly recommend going over to your Chapter 6 PowerPoint. I'm just going to be highlighting a few of the more common ones that you will possibly see within your massage office or can do the most relief or help for these conditions. Now, just as a refresher, you have your central nervous system, which includes the brain, and the spinal cord, which is encased in the vertebral column, otherwise known as your spine. And of course, your spinal cord is surrounded by the cerebral spinal fluid. You have your peripheral nervous system, which consists of your cranial nerves, your spinal nerves. And this system is divided into the somatic and autonomic nervous systems. Now, the central nervous system disorders that we are going to discuss are spina bifida, cerebral palsy, ADHD, which is attention deficit hyperactivity disorder, autism spectrum disorder, seizure disorders like epilepsy. I will not be covering traumatic brain injuries. These are in your main PowerPoint. We will briefly talk about spinal injuries, not so much spinal cord injuries. Spinal cord injuries are an absolute contraindication when they are acute, and there are multiple local contraindications to the spine and the surrounding tissues even after something like that has healed. And we will not be covering brain and spinal cord tumors in this lecture, but please refer to your full Chapter 6 PowerPoint to get more detailed information on those. I also highly recommend paying attention when we get to Chapter 16 because it goes further into detail on how to conduct a massage for people with central nervous system disorders. There are a couple of different stages of spina bifida. The spina bifida occulta is when a gap exists in the spine, but the meninges, the cerebral spinal fluid, and the actual spinal cord does not protrude or what we would term herniate out of the spine itself. The second stage is where the meninges and the cerebral spinal fluid actually herniate, but not the spinal cord. The final stage is when the cord itself, the meninges and the fluid, herniate and are visible on the back. And that is usually what people think of when they state someone has spina bifida. They've had surgery, they have this protrusion on the back. You absolutely, for anyone that has this condition, you're going to avoid the affected area. If it is someone with stage 1 or stage 2, you're going to put very slowly applied light pressure. You're going to avoid passive range of motion on the lumbar spine. You are not going to move them. You are not going to force the spine to contort in any manner. You do not want to do anything to exacerbate this herniation. If they have a mobility impairment because of the spina bifida, you're going to avoid passive range of motion on those joints as well, because there is a very distinct possibility that they have reduced bone density, just like someone with osteoporosis. If they require mobility devices like a wheelchair, some type of splint, you need to adapt your massage for those devices. A fun way to remember spina bifida is it literally means split spine. Now we get to the potato of central nervous system disorders. When I was growing up, everyone said cerebral palsy, and I know in the last decade, people have switched to saying cerebral palsy. Whichever way you say it, it is a movement disorder caused by brain damage during either your stage as a fetus, at birth, or in very early childhood. There are a couple of types of cerebral palsy. One is spastic. This is the one that is most commonly recognized. It causes uncontrollable muscle spasms, making fine motor movements and also some gross motor movements extremely difficult. There's a dyskinetic version where they have uncontrolled movements, or their normal movements are very slow and jerky. Like they may be able to reach out to grab a glass of water, but it's going to be a very slow movement and their arm will be moving back and forth as they do it. Whereas with a spastic version, they are uncontrollably shaking and unable to grab it. In the ataxic version, they have gait disturbances and loss of balance. They cannot walk correctly. They often need a walker or perhaps a wheelchair. And there's mixed, where they have a combination of all types. Now, massage is absolutely excellent at helping relieve some of the tightness that is caused by the constant muscle spasms with this disorder. However, when working on one of these clients, you can never try to do a forceful passive range of motion. Forcing a spasming muscle against what it's trying to do, moving it in a forced flexion or forced extension, can cause micro tears in the muscle or the tendons or even in the ligaments of the joint. You need to use slow applied light pressure, and you need to obviously adapt your massage if they have mobility devices. Understand that many of these clients will have speech impairments and may not be able to communicate their needs to you as effectively as another client. While massage is extremely effective at temporarily relaxing these muscles, understand that these muscles spasm almost continuously, or at the very least uncontrollably, and so they tighten over time. So please enjoy this next short video of a client with this condition speaking about his experience receiving massage therapy and the relief that it gives.
Hi, thanks for the comment. I know with other people with CP, it does help. And with me, it does help a little bit. But the problem I have with that, that way is right when I'm done, my muscles go back to the exact same level as they were before. So it does help a little bit when it's getting done, but it doesn't help in the long term. But it's nice to have a release every once in a while. Have an awesome day.
So this next one, attention deficit hyperactivity disorder, ADHD, is on the list because it is so prevalent in diagnosis these days. The affected person often displays inattentiveness, hyperactivity, impulsivity, or a combination of these things. Now, massage with ADHD, your book states that shorter sessions may be more appropriate because these clients may have trouble lying still for long periods. I have not found that to be the case unless you are focusing on an area too long or making repetitive strokes that don't seem to have any fluctuation or change in them. If you are moving at a steady pace across the body or changing from petrissage to effleurage to, compression, and alternating the ways that you are working on the body, it's usually enough stimulation to keep them interested and to keep them from fidgeting or twitching, unless it is a very strong tic that they have. Very often these clients will be extremely talkative on the table. Let them do it. It's a type of release. It is a symptom of some types of ADHD. Absolutely. You can teach parents and caregivers to massage children that are affected with ADHD. It does have a calming effect, especially towards nighttime. One thing your book warns about is that some of your clients with ADHD might be hypersensitive to touch. However, this is usually because they have a coexisting disorder, like autism spectrum disorder, which is the next one we're going to talk about. Your book states that they have difficulty communicating and forming relationships. They usually manifest within the first 3 years of life. You can tell if someone is autistic or if they have ASD. And as of right now, it is still classified as mild, moderate, or severe. This is usually in terms of the ability to show emotion and what people term as if they are high functioning or low functioning or verbal or nonverbal. Now, things to keep in mind with massage and autism is that there are very often touch intolerances. They are very hypersensitive to touch in a lot of cases. Sounds, smells, textures. Sheets can feel too dry and rough. Some people don't like tinkling sounds. Very often for those with both ADHD and autism, green noise, brown noise, and sometimes pink noise seems to help with green and brown noise, I think, sort of topping the list. We should definitely check those out to have them on a playlist or just as a recorded sound to play on a loop in the background in your massage therapy office for patients that have sound sensitivities. Very often, people with ASD will do better with shorter sessions when first beginning to get them introduced not only to you, but to the office and to the way that you are touching them. You can ask them what position they use to calm down or to fall asleep in. I would ask them to go into the position that they feel most comfortable in, not necessarily the one that they use to fall asleep in, because very often when someone with ASD is stimming to relax or going into a comfort position, it's not necessarily going to be one that is conducive to actually having a massage. Quite a few people that I know personally with autism happen to kneel on their knees and bend forward with their face on the ground very close to their knees. And one person in particular calls it the comfy position. This is going to be nearly impossible to give a good massage in. You are going to communicate continuously. You're going to tell the client what you're doing and why you're doing it so that your massage doesn't seem unpredictable or scary. This way you're not triggering an anxiety attack or any type of stress that's related to someone new and strange touching them that they might not be okay with. You definitely ask if they've had previous massage. If they tell you things that they were comfortable about in their previous massage, absolutely try to duplicate it. If they tell you that they dislike something like the tinkling of piano music, try to absolutely avoid those things. They don't like firm pressure in a particular area, or they don't like pinchy or pokey feelings. You need to adjust your massage to only use the flats of your hands, the flats of your fingers, rather than pressing in with the fingertips or using your thumb for any type of pressure. If they have a preference for routine or the sameness each time, You really need to document that routine in your soap notes so that you can repeat it to make them feel comfortable, to make them enjoy that massage each and every time. You're going to use strong or deeper pressure. I highly recommend compression, not necessarily using any fingertips or even using trigger point or neuromuscular therapy during these massages, but just firm downward pressure. A lot of times you hear that weighted blankets work wonders for people with ASD in terms of relaxing when it comes to laying down to take a nap or just to relax in general. That firm pressure helps to reduce touch aversion and nervousness and anxiety. They don't have that tickly feeling like, oh, where's that finger going to go? And it's just lightly running across the skin, which is stimulating that entire dermatome that's attached to it. A great technique that's often not given enough credit is shaking, or just laying your hands flat and gently rocking the body, which helps to reset the nervous system and actually has a very calming effect on the body and on your client. Absolutely discontinue any massage technique or the massage itself if your client starts to show signs of distress. The next one you need to make sure that you are familiar with is seizure disorders like epilepsy. A seizure is an explosive episode of uncontrolled and excessive electrical activity in the brain. Say that 6 times fast. It can be limited to a single brain area, which is called a focal or partial seizure, or it can be a generalized seizure, which is more diffuse across all of the brain areas. Epilepsy is a disorder when someone has recurrent seizures. So massaging a client with a seizure disorder is really about knowing what triggers them. No contrasting light-dark patterns, flashing lights. Ceiling fan movements is really important, especially if you have a light that is casting a shadow of ceiling fan blades. And if it is running at a medium or low speed, where you have that constant shadow light, shadow light, shadow light rotation, that can actually trigger a seizure. Some strong smells can trigger seizure, so please avoid aromatherapy or strongly scented oils or lotions if this is a client that has a scent trigger. Absolutely. The Epilepsy Society says to absolutely avoid rosemary, fennel, sage, eucalyptus, camphor, and spike lavender, as well as hyssop. These things have extremely strong scents that can absolutely trigger a seizure. So what do you do if someone has a seizure? You're going to stay calm. You are going to try to gently place them on the floor. Put a pillow or a cushion or a jacket under their head and roll them onto their side. And obviously you're going to remain with them until the seizure ends. You will not put anything in their mouth or try to pry their mouth open. You will very likely get bitten. If you are very concerned, obviously call 911. If this is a client that has warned you that this is going to occur and has walked you through this, try not to shake them out of it. Do not be nervous, but do not try to restrain them in any manner. This could trigger a very aggressive reaction that they may not be able to stop themselves from doing. Additionally, do not offer them any food or water for quite some time after a seizure to prevent any choking hazards. Please get familiar with this recovery position. This position is not only the most comfortable, it is head supporting. The position of the knee is going to stop the body from rolling onto the stomach, rolling face forward so that they are unable to breathe. And putting them in this position with the airway open prevents them from choking, especially on their own tongue. Spinal cord injuries. It's an injury causing paralysis distal to the area of damage. I've hurt my cervical spine and now I can't feel my arm. What do we call this total loss of ability to move or feel sensations in my arm? This is paralysis. What do you do if you have a client with a spinal cord injury? You are going to postpone it. This is an absolute contraindication. Any pressure that you put on joints, especially the shoulders and the hips, are going to shift your spine, which is going to aggravate a spinal cord injury. This is called the spinal shock stage. This acute stage of a spinal cord injury is an absolute contraindication. Now, afterwards, after they have begun healing and you are allowed to start doing massage, you are not going to do any deep pressure over the bones of the spine where they have had this injury, and you will not do any forceful passive range of motion whatsoever. There are also no vigorous massage techniques that should be applied to the legs. Why? You shake that large muscle in the thigh, you're going to shake the hips, which shakes the sacrum, which shakes the spine, and you could possibly re-aggravate the spinal cord injury. At the same time, please realize if they have suffered paralysis from a spinal cord injury, there may be coexisting conditions. They may be contractured because their muscle is in a constant spasm. They may have these decubitus ulcers, these bed sores, from being unable to move their positions if they're not being flipped and turned or get enough relief, and they are sitting consistently on one spot because they have suffered paralysis for a long period of time. Please be aware of skin issues from that lack of movement. Parkinson's disease. This is where the neurons deteriorate in an area of the brain producing dopamine, which regulates voluntary movements, among other things like emotion, mood, and motivation. It is very common among older adults. And these abnormal movements could be tremors. The muscles can become rigid. They may move very slowly, and they will have postural instability. If you are massaging a client with Parkinson's disease, you want to allow more time for the massage activity. It's going to take them a while to take off their clothing, to put their clothing back on, to climb on or off the massage table. They may need assistance to do so. To make it more comfortable for them and more accessible, you might want to consider massaging entirely through their clothing, or only keeping them in one position if turning is very difficult for them. Absolutely be diligent about safety. You're going to set your table low so that the client can put both feet flat on the floor and sit while transferring either to a wheelchair or standing to a walker. And no cushions on the table when the client transfers. We all want a nice big fluffy massage bed so that the client feels like they're laying on a cloud sometimes. However, this creates instability. Speaking of instability, I want to take a brief moment and point out the various images of an unstable spine or a spine that has issues with the discs itself. When you look at your main Chapter 6 PowerPoint and some of the terminology both in the ABMP practice exams that you're doing and in the book, I want you to pay attention to the different issues with discs in the spine. In this top picture, you see a degenerated disc. This is the disc that has started wearing away. The next disc issue is a bulging disc. This is when the disc has become compressed between the vertebrae and it is now herniated. It is bulging outward, creating pressure. The one below it is a fully herniated disc. You can see that it is leaking in the back towards the spinous processes. The one below that is a thinning disc. You see where it is wearing thin and it is creating uneven wear patterns in that vertebrae and allowing the spine to sit differently because it no longer has that even cushion. The bottom one is a disc degeneration, with an osteophyte formation. This is when the vertebrae actually start growing over, and you will see that they create little bone spurs that can rub up against each other or entrap nerves. Looking to the right, you see a degenerative disc. Above it is a healthy disc that is nice and firm, and it seems to be even in thickness all the way across. This degenerative disc has osteophyte formations coming on the vertebrae above this disc that has thinned, and you can see as the disc is thinning, it makes the space for the nerve much, much smaller, and these bones start to clamp down and impinge this nerve. If this is one of the nerve pairs in your cervical spine that feed your arms, what do you think that's going to do? You're going to feel tingling. You're going to feel pain. You're going to feel sensations across an entire dermatome. So your whole skin section will feel some sensations because of this impingement. You might even suffer from paralysis or uncontrollable muscle spasms, because all of that information to move that muscle or to feel sensation is coming through that nerve that is now being pinched. You can imagine that these nerves are like the garden hose feeding information to your muscles, and somebody has just pinched that garden hose. They've clamped it off, and now that information is flowing either at a trickle or not at all. Speaking of pinched garden hoses, one of the most garden hose-like nerves in your body is the sciatic nerve. And patients will very often complain about sciatica, otherwise known sometimes as piriformis syndrome. Now, sciatica is pain down the sciatic nerve. It's coming from the lower back into the buttock, usually on the lateral side of the buttock, and into the back of the thigh and all the way down the leg on some occasions. This is usually a symptom of another condition like a herniated disc or stenosis from a bone spur. You know, we saw some of those osteocyte formations. Now, as those thinning discs collapse and those nerves get pinched, you can absolutely pinch the root of this sciatic nerve. This picture shows where the roots feed into the lumbar spine and the sacrum, and how a nerve compressed by a herniated disc may compress that sciatic nerve and create pain down the entire length of the leg.
We're talking about piriformis syndrome. So piriformis syndrome involves this muscle right here. That is your piriformis. It is a deep hip rotator. You can tell from where this attaches here on the interior. It's actually on the interior part of your sacrum and the top of the femur there. Okay, we're going to be pulling. When this muscle shortens, it's going to rotate that leg like a clock. Imagine that's why it's called a deep hip rotator. Now, the issue, and I'm going to tell you that piriformis syndrome, you might go 50-50 on whether people think this condition even exists. Because if we back up here, you can see that a lot of people blame the sciatic nerve, which is that primary yellow, the big yellow one there. But there are more nerves in this area that can cause issues. Like you can compress any one of these and get back pain if you're, or pain down your leg. This is the cutaneous femoral nerve. So there are plenty of things that would indicate or don't indicate that the sciatic nerve is the main offender here. And there's another reason for this, is that in this muscle, and I'll throw up a picture, that this nerve can actually perforate or bifurcate through that muscle, and there will be no symptoms. So it is not an indication when somebody tells you, oh, you have piriformis syndrome or you get some sciatica. It does not mean that you have this condition automatically. And that being said, this can be a frustrating thing to hear, but
It can absolutely be frustrating to hear that you're not really sure what is causing that sciatica or that piriformis syndrome. That nerve goes right through the muscle, as well as several layers of your sacrum and your vertebrae. You can have an impinged nerve at any multitude of points in that area. So let's talk about massage and sciatica. You're going to postpone it if the client has extreme difficulty in terms of getting to the massage because they have severe pain, or if they're so inflamed that you cannot touch anywhere in the area without them getting significant discomfort. Otherwise, you're going to position them where they are comfortable. You will not do any forceful passive range of motion to either the spine or the hip. Deep compression is an absolute excellent way to get the piriformis muscle to relax. You can do deep effleurage, long stroking motions to stretch the muscle, and friction over the femoral attachment and along the entire length of the piriformis. You always want to push the buttocks down towards the feet. Push those glute muscles towards the feet to stretch them. If someone has lower back pain and you start to push from the piriformis proximal to the head, you are going to create a shortening in those muscle fibers. You want to pull lateral and distal each time. You can laterally rotate the hip and flex the knee. You can rotate the leg as you flex the knee, and these all will help to move and help you massage the piriformis in its shortened position and lengthened position in alternating states. Absolutely, you can recommend self-stretching, and this short video will show you how that works.
Piriformis-related issues like piriformis syndrome or sciatica are often a result of what's happening on the backside of the pelvis. Usually in these circumstances, we have a situation where this sacrum is being pulled closer to this innominate bone, and they're unable to effectively separate. This shortens the piriformis and other muscles on the backside of the pelvis, and that can lead to compression of the sciatic nerve that runs down the leg. What tends to help a lot is creating length and opening up this space, which will help take stress off of these tight muscles.
The last one we're going to talk about today is the carpal tunnel syndrome. This is compression of the median nerve within the carpal tunnel. The median nerve serves the palm side of the thumb, index, middle, and lateral half of the ring finger. Please be aware that this can be caused by inflammation. It can be caused by impingement of the nerve in general. It can come from further up the arm in the forearm, and sometimes impingement of the nerve at the root towards the cervical spine can also mimic symptoms of carpal tunnel syndrome. Please watch this video to see exactly how this nerve goes through the carpal tunnel and how it innervates the fingers.
All right, Punishers, we're talking about the mechanism of the carpal tunnel. So this is your hand. These bones right here are called your carpals. They're your wrist bones. And this is the flexor retinaculum that forms the carpal tunnel. Okay, so there's a bunch of stuff passing through this hole, which includes 9 tendons and a very important nerve called the median nerve. Now here you see it represented as pipe cleaners, kind of innervates through the hand. But the important thing to pull away from this is that these tendons that are constantly moving your fingers are wrapped up in this space with this. Now this is an acute overuse injury. That is what it causes it most of the time, is just overusing your hand, flexing it back and forth too much. You see a drop in symptoms in November in the male population. Now this is the nerve pattern for the median nerve. Pay special attention to the ring finger because it only innervates this side, not this side. You can get pins, needles, pain, all of that stuff.
Massage is extremely beneficial for carpal tunnel syndrome, and so is stretching. There are nerve stretches that you can do for the median nerve. You absolutely want to massage the palm, stretch the palm, massage the forearm. You can do passive range of motion of both the anterior and posterior forearm muscles, and you can teach them ways to do self-massage and self-stretching. One of the most effective forms of massage modalities that I've ever used is what I call rolling pencils. It is taking the flats of your fingers and rolling back and forth across, like cross fiber friction, all of the forearm muscles that are running diagonal from the hand to the bony landmarks around the olecranon process. You are going to break up any adhesions that are in between those forearm muscles. You're just going to roll your hand across in a very wide cross fiber friction motion. You're going to prop the arm up on the elbow, cup the forearm and the wrist in both hands, and apply steady downward squeezing pressure. While I would never state this as definitive to a client, there have been many cases of proper stretching techniques and massage actually preventing someone from being required to get carpal tunnel syndrome surgery. Massage is good for carpal tunnel syndrome. Massage is good for carpal tunnel syndrome. That's going to do it for your Chapter 6 lecture. Please take your practice ABMP exams and study the terminology as well as your Chapter 6 full PowerPoint. And I will see you for the next lecture. Have an excellent day.